Hello, everyone. My name is Dr. Purvi Parwani, and I'm the Early Career Chair for SCMR. And today I'm honored to be joined with Dr. Sven Plein, who is our incoming Vice President of SCMR and also Professor at University of Leeds. And we are going to be discussing about role of CMR in COVID. So Dr. Plein, welcome.
Hello. Hi, Purvi. Nice to talk to you this morning.
Yes. So we are doing this as part of our video initiative of SCMR 2021. For more updates, you can follow us on hashtag SCMR 2021 as well as YCMR. And don't forget to check out our Twitter as well as our YouTube platforms for such videos. So coming to the topic, Dr. Plein, so there has been a lot of new development when it comes to COVID and role of CMR in COVID. And this pandemic, has been it has put a lot of limelight on CMR in some cases in a negative way, particularly, or, one can say that we have found a lot of new avenues. So tell us so far till today, whatever literature exists, what are your main takeaways?
Yeah, so we have to remember it's only 1 year since COVID emerged. I think at the moment we're seeing the first anniversary of the emergence of COVID as a pandemic. So it's quite fascinating to see the literature that has already come out there in such a very short time. But I think that always has to be borne in mind that many of the findings we're seeing now are really premature, they're early. There's very little that's been confirmed in prospectively planned systematic evaluations. The evidence that we're seeing is mostly just observational studies of the first cases that we've seen with cardiac MR. I wouldn't say there's been any negativity around cardiac MR. There's certainly a lot of interest because of the findings that have been reported. And of course, cardiac MR, with its unique ability to tissue characterize, is probably the key modality to detect beyond blood biomarkers cardiac involvement in COVID infections. And it's quite impressive to see the amount of literature that's already out there, which really started with the first case reports, showing signs of typical myocarditis findings in some patients with COVID. So that seems to be one thing that we see, but it's relatively rare, I think, that you see the classical myocarditis findings in COVID heart involvement. Then there have been studies that suggested abnormalities even in patients without known cardiac involvement. That was interesting. That was a study that came from Frankfurt a few months ago, which suggested there were abnormalities on mapping, on parametric mapping in the heart of patients who even had no symptoms of cardiac involvement with COVID. And we're going to see some publications coming out in the near future that I can't say too much about yet, but I have some advanced knowledge about studies coming out showing the results of cardiac MR in patients who are troponin positive. And this is one of the things that we're going to discuss in great detail at the meeting, because these studies will be published by the time we have SCMR 21. So let's, to summarize, I think currently we're still learning about the role of cardiac MR in COVID. We're still learning about when it's sensible to use cardiac MR in COVID infection. We're still learning really what it means if we see abnormalities in cardiac MR in COVID. There is a lot of ongoing research that's prospectively planned and will tell us over the next year or two a lot more about the implications of these findings. But we have to remember we're at the very beginning still of evidence emerging in this pandemic, which is only 1 year old. As crazy as it seems like this has been going on for half of our lives, but it's only 1 year, of course, since the first cases were reported.
No, thank you for going into depth of that. You're absolutely right. There's CMR has a lot of potential when it comes to COVID. And what I meant by negativity is a lot of negative attention that was brought on by on social media, for which actually the society put out a statement clearing it out. So I have heard that at SCMR we are going to have a lot of COVID sessions. Can you tell us more about what this is going to what we are focusing on in at the meeting?
Yes, of course. I mean, COVID is for all of us, the phenomenon that's changed the way that we live, it's changed the way that we practice medicine, it's changed the referrals that we get for cardiac MR.
Yep.
And of course, the meeting, because of COVID, is the first one that we do virtual and we can't meet in person. So COVID is the leading theme, I guess, for this meeting. And what we're trying to show to people is how cardiac MR, what the current evidence is. Really, the questions we just discussed in the first part of this interview. What exactly we know at this point in time on how COVID affects the heart, what the findings with cardiac MR might be, and what they all mean, what it all means. And most importantly, referring back to the comment you made before, to figure out when we should use cardiac MR, which patients should have cardiac MR. Of course, not everybody can have it. That's just impossible with the limited resource that we have. So we need to really figure out which patients we should image and what those findings might mean. So we have multiple sessions throughout the meeting on COVID, and quite fittingly, we start with the opening plenary, which is all on COVID, which will have a wonderful overview of what we currently know from David Blumke. We will then also discuss findings in children that we haven't talked about yet. There is an inflammatory syndrome that seems to be most common in children, one of the manifestations in COVID. And we will explore how cardiac MR can help with those. And then we have a debate around the key question of which patients should undergo cardiac MR. Should we screen asymptomatic patients with troponin release, asymptomatic patients without troponin release? Is there any value in doing that? Or do we focus on those patients with clear clinical manifestations of severe heart involvement, an abnormal echo, a large troponin rise? And we have two wonderful presenters, Eike Nagel and Mariana Fontana, who are going to talk us through their individual studies. And I promised you already that there's going to be some new information that you will not have seen. So you have to come to SCMR to see that debated. The publication will come out just before SCMR probably, but we will be hearing Mariana discuss these findings exclusively in the opening plenary. And then later on in the meeting, we have other focus sessions, we have abstract sessions, we have discussions around use of cardiac MR more broadly in pandemics and infections in general. But you will see this weaving through the meeting from the beginning to the end.
That's amazing. I'm really excited. And you're right. I think that there is a lot of unpacking. It seems like that's going to happen at the scientific session. I know that society has also put out a lot of resources. Can you tell us a little bit more about what are the COVID resources for the clinicians struggling with this problem, clinical problem?
Yeah, so from the very beginning, we've tried to guide or give guidance to clinicians who, at the beginning, the first question was, how do we safely conduct cardiac MR in patients who are COVID positive? So we put out some guidance on a guidance document, and that we have a toolkit for using cardiac MR in COVID patients. We've recommended imaging protocols, which we thought needed to be brief, but focused on the key findings. So all that's available both in publication, but also through our website. We've also have a COVID case of the week section. So most of the listeners may know that there's the case of the week on the SCMR website, but we've created specifically a COVID case of the week section where you can submit your cases. You might have an interesting case, a case you're not sure about, or a case that's just very striking. So we wanted to give a platform for people just to share the findings that they see in COVID heart involvement. And we have our SCMR registry, which now has a section specifically on COVID. So for those participating in the registry, we're collecting cases, and we have several hundred now of COVID heart cardiac MR scans, with a particular subsection on athletes. I forgot to mention that so far. There is a lot of debate around whether athletes need cardiac MR as a screening tool when they've been COVID positive. Another thing we'll be discussing at the meeting, but also something we're particularly interested in our registry. That, as I said, if you're participating, you can submit cases already. If you're not, then you can perhaps consider joining the registry and make this the most powerful resource for cardiac MR around the world. That's
great. So I know this is probably more applicable now that for a lot of early career, I think across the world funding has been taken away because of COVID, because of the financial implications. Institutes are running through. So this is really helpful, what you said. And you are going to be the incoming vice president for the coming year for SCMR. Congratulations on that. But tell us about what's the what is the vision of society for the next coming year?
Yeah, so obviously I'm coming in at a challenging time for the society, and you mentioned how hard things are for young researchers, equally for more experienced researchers, because access to funding is hard. We all know that, and it's unlikely that it's going to get a lot better in the year or two to come. So as a society, we will continue to focus and really improve our online presence. So we're going to put out many more online resources, webinars. We would like people to be able to talk to each other, participate in online discussions. Our social media, you're one of those most prominent on our social media outlets. So we're going to strengthen all of those resources, because we think it's unlikely we'll be able to meet in person in the way we've done even next year or the year after. So we're hoping that SCMR 22 will be at least a hybrid meeting where those who can travel can come together, but we're going to continue to have an online presence and a virtual meeting running in parallel. And I mean, some of it is for the society to stay intact, because of course also the society suffers from the lack of funding, from the change in income with industry, with individuals. All of those things are just as challenging to the society as they are to individuals at home. So our strategy, I guess, is going to be shifting as much as we can to the online space, while consolidating what the society has always done and continue to offer meetings in person whenever they're possible again.
Thank you so much, Dr. Plein, for your wonderful insight into this topic, as well as spending your time with us today.